Victoria Hand Project grew from a research laboratory at the University of Victoria to a nonprofit and eventually into a registered charity. Beginning as a research project in 2014, our founder, Dr. Nick Dechev, and early team member Josh Coots traveled to Guatemala to provide 3D printed devices to several local amputees thanks to a $100,000 grant from Grand Challenges Canada. This included Isabel, a farmer who, like other participants, asked to keep the device after the trial ended since it provided them with prosthetic care they wouldn't have been able to access otherwise. Following the hand's success in Guatemala, VHP began further expanding its reach, starting with Ecuador in 2015. As interest in the Victoria hands grew, the design itself began to change as well. By the time the team was traveling to Nepal in 2015, the Victoria hand had evolved to support silicone fingertips for added dexterity and more realistic design. In April 2015, VHP was awarded a Phase 2 grant from Grand Challenges Canada to fit 25 patients in Cambodia and 25 patients in Nepal with Victoria hands. Later that same year, the team made leaps and bounds of progress. With the support from students and volunteers, Victoria Hand Project expanded to Haiti, Cambodia, and Egypt. Patients like Yusuf and Bun expressed their admiration for the design, and we were thrilled to work with such amazing teams everywhere we went. In 2017, the team was granted $250,000 from Google.org to make our new international partnerships permanent and support people with amputations in the regions for years to come. Then, in July 2017, the newest iteration of the hand, V200, was launched, giving the hand more features and better aesthetics. Thanks to the funding from Google.org, Victoria Hand Project was able to start a new partnership with Korsu Hospital in Uganda in 2018. Limforge Technologies, a then US-based nonprofit, transferred their technology to Victoria Hand Project in 2019. By joining forces, beneficiaries could now choose between the more cosmetically realistic Limforge arm or the more practical Victoria hand, or receive one of each. In 2020, VHP began a new partnership in Kenya with a grant provided by Domino's Canada, where we first met young Benamin and the incredible team at St. Luke's Orthopedic and Trauma Hospital. We also started working on our new above-elbow prosthetic arm, aiming to help a population of amputees with few options for care. Then, in 2021, the team completed the latest Victoria hand development, bringing the V300 to life. This hand supported the use of metal linkages, allowing for more robust and practical use of the hand. Victoria Hand Project also officially became a 501c3 charitable organization in the US and became a registered charity in Canada in 2021. This has allowed us to continue to supply Victoria hands free of cost to those in need and further support our mission. Canada and the US were next, growing quickly with partnerships in Saratoga Springs, New York, San Antonio, Texas, and Omaha and Hastings, Nebraska. With the generous support of TD Bank, from 2020 to 2023, 4 new partnerships were established. With the help of patient feedback and prosthetist knowledge, the development of our custom software began, bringing ease of manufacturing into our care process. 2023 also brought the official launch of the above-elbow transhumeral prosthetic arm. The Victoria Hand Project transhumeral device brings prosthetic care to a population of amputees faced with extremely limited options. This prosthetic opens the doors for many people who would likely never receive care otherwise. In 2023, we were able to establish new partnerships in Pakistan and Ukraine. In both locations, the team was met with knowledgeable prosthetists and eager patients who learned very quickly how to use the devices. From January of 2023 to now, thanks to major public support for our Hands for Ukraine campaign and our wonderful grantor, Choose Love, our partners in Ukraine have provided prosthetic care to over 140 Ukrainians. Victoria Hand Project has big plans for the future, expanding into areas of great need and further supporting our partners in locations where prosthetic care is limited. VHP constantly strives to improve our technology, developing solutions for complex amputations such as a partial hand, and working closely with patients to create prosthetic devices that evolve with their feedback. Over the last several years, VHP has grown to help over 400 amputees receive care in 12 countries around the world, returning numerous times to several of our partner locations to help update clinics on our newest designs and fit new patients. This year, we hope to continue our mission to bring people life-changing devices and engineer novel prosthetic solutions. Please consider supporting the project and giving those in need the prosthetic care that they deserve. Thank you for 10 years of Victoria Hands and helping us make a difference in the world.